This is an introduction of MIURA's new ETstera low-temperature sterilization technology. There are many microorganisms in the environment in which we live, including viruses such as influenza and bacteria such as Salmonella, as well as fungi and protozoa. Bacteria can be divided into gram-positive and gram-negative bacteria based on their structure. Endotoxins are pyrogenic toxins contained in the cell walls of gram-negative bacteria, which remain even after gram-negative bacteria have died. Even an extremely small amount of endotoxins making their way into the bloodstream can trigger a fever, and a large amount can result in multiple organ failure. In order for us to live worry-free lives, it is vital to eliminate viruses and bacteria in an appropriate manner and create a clean environment. As shown below, there are a range of techniques for sterilization and disinfection. ETstera, which we are showcasing today, is a form of hybrid processing that utilizes a combination of hydrogen peroxide gas and ozone gas. This sterilization method is to inactivate endotoxins at temperatures of 60 degrees Celsius or lower, which can be considered low temperature for the sterilization method. Inactivation of endotoxins has been difficult with existing sterilization technologies, which could only be applied to a limited array of equipment because they relied on dry heat sterilization methods. As mentioned previously, endotoxins are difficult to inactivate with conventional sterilization methods. However, strong oxidative action breaks down chains at the molecular level, allowing inactivation with losing toxicity. Rather than using only hydrogen peroxide gas or ozone gas, ETstera combines the two to promote accelerated oxidation and improve sterilization. Combining hydrogen peroxide with ozone is an efficient way of generating hydroxyl radicals, which are strongly oxidizing and are the most active of all the molecules known as reactive oxygen. Hydroxyl radicals are strongly oxidizing, and the reactive oxygen they contain is effective in breaking down endotoxins. We will now explain the features of ETstera. The most significant feature is that ETstera is able to leverage accelerated oxidation to inactivate 99.9% of endotoxins under fixed conditions. This makes it possible to suppress the proliferation of abnormal cells caused by endotoxins. Conventional sterilization methods capable of inactivating endotoxins rely on dry heat sterilization and thus can only sterilize a limited range of objects. ETstera is able to inactivate endotoxins at low temperature under fixed conditions. The second feature is ETstera's ability to reduce the amount of hydrogen peroxide gas used. Mixing hydrogen peroxide and ozone gas can significantly reduce the amount of hydrogen peroxide used. In addition to reducing the amount of residual hydrogen peroxide, this technique also reduces its toxicity and reduces health risks to operators. The graph at the left shows endotoxins inactivation rates for hydrogen peroxide sterilization, sterilization with ozone alone, and mixed gas sterilization. This ETstera mixed gas sterilization technology is able to inactivate 99.9% of endotoxins under fixed conditions. The graph at right is comparison of residual hydrogen peroxide in different materials when sterilized solely with hydrogen peroxide and when sterilized with mixed gas. Lowering the amount of hydrogen peroxide used leads to less residual hydrogen peroxide, reducing the effect on equipment and operators. MIURA is evaluating the use of ETstera, this mixed gas processing technology which combines hydrogen peroxide gas with ozone gas in a range of fields. For example, area decontamination. ETstera is gentle on facilities, and it is expected to improve the efficacy of disinfection. Furthermore, it is anticipated to inhibit the drug-resistant bacteria that are now becoming problematic due to the extensive use of drugs, such as antibiotics. MIURA hopes to deploy ETstera in a variety of domains, including area decontamination, suppression of drug-resistant bacteria, and reproductive and regenerative medicine. We hope you will look forward to future efforts from us. The best partner of energy, water, and environment, MIURA.